Greetings, Prof. Dr. Zainal Arifin. I'm PRABHWINDER KHAKH, anak perempuan JASWINDER SINGH, MATRIC number BM24110048, first year medical student in UMS. For this special study module, SSM, I'm going to talk about specialists in cardiology. In my presentation, first thing I'm going to talk about is a brief anatomy of the heart, the physiology of the heart, the pathology, the technology related to the heart, the well-known specialists in the field of cardiology, and the conclusion and references. Moving on with the brief anatomy of the heart. The heart is approximately the size of your fist and is located at the mediastinum, on the superior surface of the diaphragm, left of the midline, and anterior to the vertebral column and posterior to the sternum. The heart has 4 chambers. There are 2 atrias and 2 ventricles. The heart also has 4 main valves, namely pulmonary, mitral, tricuspid, and aortic valve. The heart layers consist of pericardium, that is a double wall sac around the heart, epicardium, that is a visceral layer of the serous pericardium, myocardium, that is the cardiac muscle layer forming the bulk of the heart, and endocardium, that is the endothelial layer of the inner myocardial surface. Vessels returning blood to the heart include superior and inferior vena cava, right and left pulmonary veins, and vessels conveying blood away from the heart include pulmonary trunk, which splits into right and left pulmonary arteries, ascending aorta that has 3 branches, and there are many more arteries and veins associated with the heart. Next, moving on to the physiology of the heart. First, about the functions of the heart. Function of the heart is to pump blood, maintain the blood pressure, facilitate gas exchange, support systemic and pulmonary circulation, regulate the heart rhythm, adapt to the body's needs for the hormonal transport, and also to maintain the fluid balance in the body. As you can see, I've inserted a microscopic view of the cardiac muscles. The cardiac muscles are striated, short, fat, branched, and interconnected. The connective tissue endomysium acts as both tendon and insertion. Intercalculated discs anchor cardiac cells together and allow free passage of ions. This intercalculated disc also allows the cardiac muscles to act as a functional syncytium. Next, moving on to the pathology of the heart. There are many diseases related to the heart, but my main focus for today would be bicuspid aortic valve. Bicuspid aortic valve disease is a congenital disease. It means that the aortic valve between the heart and the aorta only has 2 flaps or cusp instead of the typical 3. With only 2 flaps, the aortic valve may have trouble closing and opening properly. As you can see, I've inserted a picture of a normal tricuspid aortic valve and a bicuspid aortic valve. Next, moving on to the symptoms of BAV, which includes fatigue, that is the most common, chest pain or discomfort, dizziness or fainting, heart palpitations, shortness of breath, especially with activity. The causes is that BAV is something that occurs during fetal development, and it's often inherited and linked to genetic mutations, so it's present at birth itself. The effect of BAV includes, first one is the narrowing of the aortic valve, also known as aortic valve stenosis. In this, the valve may not open fully, and the blood flow from the heart to the body is reduced or blocked. Next is the backflow of blood, also known as aortic valve regurgitation. Sometimes the bicuspid aortic valve doesn't close tightly. This causes the blood to flow backwards. The last one is the enlarged aorta, also known as aortopathy. An enlarged aorta increases the risk of a tear in the lining of the aorta, and this tear is called an aortic dissection. The diagnosis of BAV can be done through an echocardiogram, through CT scans, and heart MRI. Other than that, a bicuspid aortic valve may be found when tests are done for another health problem. The healthcare provider may hear a heart murmur when listening to the heart. Next, talking about the treatment of BAV, medications like beta blockers or diuretics can help with the symptoms. And through surgery, that is aortic valve replacement, aortic root and ascending aorta surgery, and balloon valvuloplasty. The treatment for a bicuspid aortic valve depends on the severity of the heart valve disease. This takes me to my next point, that is a technology related to the heart. The first one is aortic valve replacement. In this, the surgeon removes the damaged valve and it's replaced with a mechanical valve or a biological tissue valve that is made from cow, pig, or human heart tissue. Surgeons use the biological tissue valve almost 80% of the time because it's safe and durable. But a biological tissue valve breaks down over time and they may eventually need to be replaced. But if the person opts to go for a mechanical valve, the person needs to take blood thinners for life to prevent blood clots. But this synthetic valve is very durable and can last for the rest of their life. Many people prefer a biological valve so they don't have to take blood thinners, but it depends on the person's age, other medical conditions, and personal preferences. Next is the aortic root and ascending aorta surgery. Surgeons remove the enlarged section of the aorta located near the heart. It's replaced with a synthetic tube called a graft, which is sewn into place. Sometimes only the enlarged section of the aorta is removed and the aortic valve remains. And the last is the balloon valvuloplasty. This procedure can treat aortic valve stenosis in infants and children. In adults, the aortic valve tends to narrow again after the procedure. So this procedure is usually only done if the person is too ill for surgery or they are waiting for a valve replacement. This heart valve procedure uses a thin flexible tube called a catheter. The catheter has a balloon on the tip. The surgeon inserts the catheter into an artery in the arm or groin. Then the catheter is guided to the aortic valve. Once in place, the balloon inflates, making the valve opening bigger. The balloon is deflated and the catheter and balloon are removed. Another option for valve replacement is the Ross procedure, that is also known as the switch procedure. It involves using the pulmonary valve to replace the aortic valve. This procedure can be a good option for people under the age of 50 who want to avoid long-term use of blood thinners. Whether to do aortic valve repair or aortic valve replacement, aortic valve repair fixes the valve without replacing it. It can be a good option for aortic regurgitation, that is leaky valve, but it cannot treat aortic stenosis, that is the narrowing of the valve. What are the complications of bicuspid aortic valve? Without treatment, bicuspid aortic valve disease can lead to serious complications like heart failure and aortic aneurysm rupture and dissection. But complications of the treatments are also there. Valve surgeries have a low risk of complications, but the possible risks include infection, bleeding, blood clots, stroke, and a heart attack. Next, I move on to the well-known cardiologist and the person that I look up to. Is Dr. William W. O'Neill. He is a medical director of Henry Ford Hospital Center for Structural Heart Disease in Detroit, Michigan. He's especially credited with creating the technique of angioplasty, which is now a common practice in cardiac care across the globe to treat heart attacks. He has carried out the nation's first transcaval aortic valve replacement, TAVR, and has more than 300 peer-reviewed articles and several book chapters to his credit. He was also one of the original members of the Interventional Cardiology Board of the American Board of Internal Medicine, and his leadership skills in initiatives like the National Cardiogenic Shock Initiative has significantly improved patient survival rates after severe heart attack. And this is why I look up to Dr. William in the field of cardiology. Lastly, as explained in my slides, the heart is an organ that amazes me the most and got a hold of my attention. My interest in this specialization continues to grow, and I hope I get to achieve my dream one day in the future. That's all from me. Thank you.